Myself Timi Thomas, Faculty, Department of OBG Nursing, Yenepoya Nursing College, Yenepoya deemed to be University. Coming to the learning objectives, at the end of the demonstration session, students will be able to identify the types of pelvis, list down the functions of female pelvis, discuss on 4 types of pelvis, and list the pelvic joints, the true pelvis, the diameters of pelvic brim, cavity and the outlet. Functions of female pelvis. The primary functions of the pelvic bone or the pelvic girdle are to allow the movement of the body, especially walking and running. It permits the person to sit and kneel. The female pelvis, which is adapted for childbearing because of its increased width and a rounded brim. We will see what are the types of pelvis. The gynecoid pelvis, the android pelvis, the platypelloid pelvis and the anthropoid pelvis. Coming to the demonstration. The female pelvis, which are having 4 pelvic bones, 2 innominate bones, 1, 2, the sacrum and the coccyx. Each innominate bone, which consists of ilium, ischium and the pubic bone. We will see about more in detail regarding the ilium. Ilium is the large flayed outer part. When we keep our hands on the hip, our hand will rest on the iliac crest, which is the upper border of the ilium. At front of the iliac crest, we can see a bony prominence is called as anterior superior iliac spine. A short distance below, we can see anterior inferior iliac spine. Similarly, at the other ends of the iliac crest, we can see the posterior superior iliac spine, a short distance below posterior inferior iliac spine. The anterior concave surface of the ilium is termed as iliac fossa. This is about the ilium. Moving to ischium. Ischium is the thick lower part which has a large bony prominence known as ischial tuberosity. The ischial tuberosity is the part when our body rests when we take our seat. Little above an inward projection can be seen on the ischial tuberosity, that is termed as ischial spine. The relation of ischial spine in relation to labor, which will estimate the station of the fetal head. Coming to the pubic bone. The pubic bone, which forms the anterior part of the pelvis. It has a body and 2 oar-like projections, the superior ramus and the inferior ramus. The rami at the lower side, which form a pubic arc. The body enclosed by the pubic bone. The ramus, that is the superior ramus and the inferior ramus, and the ischium is termed as obturator foramen, which contains a deep cup in order to receive the head of the femur, which is called as the acetabulum. We can see in the lower border of the innominate bones, there are 2 curves. One is extends from the posterior inferior iliac spine to ischial spine, which is a little wide and round, are termed as greater sciatic notch. The lesser sciatic notch, which extends from the ischial spine to ischial tuberosity, that curvature is termed as lesser sciatic notch. Coming to the pelvic joints. There are 4 pelvic joints, One is symphysis pubis, right and left sacroiliac joints and the sacrococcygeal joints. Coming to the true pelvis. The true pelvis has got the pelvic brim, pelvic cavity and the outlet below. We will see in detail about pelvic brim. The pelvic brim, which is round in structure except the sacral promontory where it projects into it. We will see about the anterior, posterior and the lateral borders of pelvic brim. The sacral promontory and the wings of the sacrum, which will form the posterior border for pelvic brim, whereas the iliac bones, which will forms the lateral walls or lateral borders for the pelvic brim. The pubic bone, which will form the anterior border for the pelvic brim. Coming to the landmarks of pelvic brim. The sacral promontory, wings of sacrum or ala, sacroiliac joint, iliopectineal line, iliopectineal eminence, superior ramus border, upper inner border of the pubic bone, upper inner border of the symphysis pubis. Coming to the diameters of pelvic brim. The diameters of the pelvic brim are classified under the epidiameter, oblique diameter and the transverse diameter. The epidiameter, which it is a line from the sacral promontory to the upper inner border of the symphysis pubis, that is approximately 11 centimeter. The transverse diameter, which is a line from the one sacroiliac joint to the opposite side of the iliopectineal eminence, that is measured about 12 centimeter, whereas the transverse diameter, which is said to be between the two iliopectineal eminence, okay, of the two innominate bones. Coming to, that is about the pelvic brim. Coming to the pelvic cavity. The pelvic cavity which extends from the brim above and the outlet below. In pelvic cavity, we will see the anterior, posterior and the lateral borders. The lateral borders for the pelvic cavity are the curvature of the sacrum and the sacral promontory. Coming to the lateral borders, it is about the sides of the pelvis, and the anterior borders, it is the symphysis pubis and the pubic bone. Since the cavity is round in structure, the all diameters, that is epidiameter, the transverse diameter and the oblique diameters are measured in 12 centimeter. The pelvic outlet. The pelvic outlet is divided into anatomical outlet and the obstetrical outlet. Coming to the diameters, the epidiameter. The epidiameter which extends from the lower border of the symphysis pubis to the sacrococcygeal joint. Coming to the oblique diameter, this is said to be between the obturator foramen and the sacrospinous ligament, which cannot be measured in this pelvis. Coming to the transverse diameter, which is said to be between two ischial spine, that is about 11 centimeter. This is about the demonstration of female pelvis. Thank you.